Moving away from this to business news, where the Federal Ministry of Agriculture and Food Security has outlined the ministry's efforts to strengthen domestic food production to reverse food insecurity in the country. The Minister of State for the ministry, Senator Aliyu Abdullahi, made the submission while presenting the ministry's 2026 budget proposal before a joint session of the Senate and House of Representatives Committees on Agriculture, Production, Services and Rural Development. He blamed funding limitations, high input costs, and structural bottlenecks as responsible for continuous low agricultural production by farmers across the country. On budget implementation, he explained that personal expenditure under the 2025 appropriation was largely implemented, but capital project execution has been significantly constrained by delayed release, stating that for the main ministry, about 30% of the capital allocation, representing roughly 18 billion naira, is yet to be released till date.
If you ask me if we are satisfied with what we have, because it's a rollover, otherwise we have some very good projects we have started, which we would have loved to have funding for. And I believe the rollover is now a constraint for us because we will not be able to have additional funds for those. But we want to seek the indulgence of this committee that what we have been given thus far, we want to make judicious use of it in terms of its application to support massive production. Now, one of the constraints we will be reporting is the fact that the price of inputs, which is driven by some macroeconomic policies, is still high for farmers and is a major source of concern. So whatever the committee can do to support us in this area.
Chairman of the Senate Committee on Agriculture, Production and Rural Development, Senator Sailu Mustafa, urged the federal government to prioritize adequate funding and timely release of resources to the agricultural sector to safeguard food security and support the country's economic growth.
Release of funds to the agricultural sector in the year 2025 is already constraining productivity and weakening the sector's ability to play its expected role in economic recovery. It is that if this trend continues and funding in this year remains insufficient or is released untimely, it will significantly undermine agricultural performance, deepen Nigerians' food and nutrition insecurity, and erode the broader microeconomic gains anticipated for the year and the 2027 to come. I therefore recommend that the federal government should prioritize adequate budgetary allocation and prompt release of agricultural and sector funds, alongside strengthening implementation mechanism to ensure that agriculture effectively supports economic growth, stabilizes food system, and safeguard national food and nutritional security.
In a related development, the House Committee has urged federal university teaching hospitals to prioritize medical research rather than waiting for emergency situations such as the COVID-19 pandemic to drive action. The call was made during the budget defense of all tertiary institutions across on Tuesday by the chairman of the House Committee on Health Institution, Dr. Patrick Emo, who lamented that teaching hospitals have largely abandoned their core mandate of research and have instead assumed the role of general hospitals. Dr. Emo criticized the chief medical directors for allocating less than 1% of their budget to research, noting that they have failed to consistently raise the issue of research funding during budget preparations.
And also community of resources to research. There are people who are naturally gifted in research. Naturally gifted. It's not really about humongous sums allocated in budgets for research. It's also about commitment, dedication, and interest. So please mentor those young people who have such inclinations so we can help the country to get better. I don't want us to spend longer times talking and talking. The challenges are well known to all of us. So I want to assure you of the commitment of the committee to partner your efforts so that we can have a seamless health system at the tertiary level, which is of course our mandate. We are available, the office is open. If you have challenges, you have concerns to raise, please write to us. Or visit the office. It is I'm meant to work with you. We can't deal with everything today. And the clerk is also very available. The deputy chair.
In his response on behalf of the Committee of Chief Medical Directors, the Secretary of the Committee and Chief Medical Director of the Jos University Teaching Hospital, Professor P. Buluwatda, stated that only about 1% of teaching hospitals' budgets is earmarked for research, adding that the research budget line is often removed during the budgeting process. Professor Buluwatda then called for increased funding for the health sector to enable adequate recruitment of qualified manpower and improved staff welfare as part of efforts to curb the ongoing Japa syndrome by Nigerian professionals.
As you are aware, many of our institutions, they are struggling with power, and power is very key and very important in our operations as federal tertiary hospitals, where we have people in ICUs on life support, ventilators, and we need power 24/7 to be able to maintain such equipment in tertiary hospitals. We have babies in special baby care units that need power, like those in incubators. They need power 24/7. So power is a major challenge in most of our health institutions. We mentioned that last year, and that was why your committee, moved to advocate for intervention in terms of alternative power supply to all our tertiary health institutions. We're hoping that will materialize, and because it will go a long way to help us. So because of that, most of our overhead goes into payment of power, because most of us are on band A. And that band A, honestly, is not easy for most of our institutions.
He appealed to the committee to prevail on the federal government to provide take-off grant for about 7 newly established federal health institutions to enable them to effectively commence operations.